Just briefly, there was also a story in the Times that was really interesting. Let's put up this graph. I think folks know two major social insurance programs that are the most successful, long-standing government-sponsored programs that we have, that really, the government, if you're looking at just dollars, does really two things, maybe three things. One is spends a lot of money on military in one form or another. The other is it's a massive social insurance program. And then the third is, to some extent, is providing services. The social insurance programs are Social Security, Medicare, and Medicaid. We pay into Social Security and Medicare, and we get money back. Medicare, for years, has provided far more in services to people who have paid in, and you got to live until you're old enough to get Medicare, than they have put in. Social Security pays out a little bit more than what you've put in, but it also keeps it safe. You can look at 401ks. All you got to do is Google 401k experiment failure, and you'll see exactly what's going on with 401ks. But Medicare, because it paid out so much more, because as people age, and if you think about it in terms of insurance, the risk pool is so high because 80% of medical costs are borne by 20% of the people. And as you get older, you tend to have more ailments that are going to cost money, whether that's drugs or whether that's procedures or whatnot. And so there was a real concern that Medicare was going to be budget busting. And then something weird happened, and these are all projections based upon the trajectory it was on through the end of the 20th century and into the first 10 years of the 21st century. And then something happened. Put up this graph. This is a graph in the New York Times. If you go up, scroll up to where this is, and you'll see. There it is. In 1983,
Ronald Reagan said, "The need for action now is clear. Healthcare costs are climbing so fast that they may soon threaten the quality of care and access to care which Americans enjoy." So,
And then watch as we go through the years, the cost keeps shooting up. In 95, it had almost doubled. In 2011, it had doubled from where it was in 95.
And they show a quote there about how Obama wanted to be more responsible with Medicare, which people forget, but that was almost happened.
And look at the trajectory. That dotted yellow line is what the rate of growth would have expected. It would have almost doubled in the next 12 years. And instead, what happened was in 2011, which is weird, just after the ACA kicked in, the actual spending created a $3.9 trillion gap over the last 10 years, 12 years, relative to where it was trending towards in the 40 years prior. And you see one big spike there. Look at that spike. That spike is in the middle of the Trump years, when the Trump administration did everything they could to inhibit people signing up in the ACA, et cetera. Now, the article attributes some of this to ACA. Other things are just that supposedly there have been better sort of control, chronic disease, et cetera, but it really falls off a cliff. I mean, really falls off a cliff in just 2011.
So it's 12,000 in 2023 per, can we just scroll back up a little bit slightly? Because the expected is, so it's 12,000, 459 per beneficiary annually. versus what was expected, which was over 22K.
Yes, and it was 13,000 in 2011. Now,
So it's gone down.
part of it could be, I mean, nobody's quite sure what any of it is. There is some of it is that there, people having fewer strokes and heart attacks. Certainly, recently, anyways, COVID oddly helped because we lost hundreds of thousands of people who were on Medicare because COVID killed them.
Yeah.
And of course, we could bring Medicare expenses down to zero if we all died before at age 64, but obviously we don't want that.
And do we expect it also maybe to go down even further once this drug negotiation kicks in? Potentially?
It's possible. I mean, now, to be clear, this doesn't, at the end of the day, impact anybody using Medicare now. The drug controls will ultimately impact people using Medicare because they'll be paying less in terms of copays. But it has protected Medicare from sort of the ghouls who wanted to cut it. This is a huge savings, $3.9 trillion over the course of 10 years. Trump's tax cuts cost about $2 trillion over 10 years. The plan to cut under Simpson-Bowles would have saved much less than $3.9 trillion. It also just goes to show you that, and the ACA did not do great, as far as I can tell, in terms of protecting or making health insurance particularly cheaper for Americans. It evened it off. It slowed the rate of increase in some instances. But the real benefit was the PPI part of the ACA. If you look it up, it wasn't just the ACA. It was the Affordable Care Act and patient protection. And the patient protection part of this, I think, it doesn't get mentioned in this article, but I think it has a big makes a big difference, because for a lot of people, you could get denied health care, or I should say, denied health insurance, which ultimately led to a lot of denial of care. You could have your health insurance pulled because you cost too much on any given year. Or you could get your health insurance pulled because you cost too much over the course of any given lifetime. And what do you do in that situation? You start to ration your drugs. Maybe you get off the drugs. Maybe you don't see as many doctors. You don't get as treated. And you try and basically get across the finish line until you're 65 and you're eligible for Medicare. And then all of a sudden, the cost associated with treating you on Medicare has grown exponentially. You can't afford your oil change on your car.
Yeah.
You put it off. You start having problems with your engine. You start having problems, and you reach some finish line where all of a sudden you can afford going to see the mechanic, and your car is going to cost you that much more. And I think that has a big part to do with it. That the quality, and I mean basic, I'm measuring quality in terms of basic, like it's literally going to be there for you, existed or did not exist before 2014. The patient protection part of this made a big difference, I think, in just people's ability to access health insurance.
Preventative care.
We still had, medical bankruptcies, not in the numbers that we had before it, but still way too many. We still had millions without health insurance, although that went down during COVID to its lowest levels because we expanded Medicaid. And that has gone away. We've kicked off, we'll get the numbers by the end of the year as to how many millions we've been kicked off of Medicaid, because we just decided as a policy choice, that was nice, but we're not really that interested in it. But that little tweak has helped Medicare. in ways that I think it's still unclear as to why. And I think part of the reason why it's obscured is because people don't want to see the value of government intervening in the health insurance industry. If everybody was on Medicare, the cost of Medicare would go up, but only nominally. Because we're already in a risk pool which is far more expensive than any other risk pool that could exist. And if you were to add people in their 50s and people in their 40s and people in their 30s and their 20s who are that much more healthy, expand the bargaining power of Medicare, begin to understand more efficiencies that can happen in terms of healthcare. If we intervene here at age 30, it's going to save us X amount of dollars when that person's 65. I mean, this is the argument. Within numbers like this are the arguments for expanding Medicare. The benefits we're seeing now are because of government intervention in the insurance industry. And it is just like basically half of, we're just getting there to like half or 3/4 or 2/3 of Medicare, which is government regulation. The big switch that would happen is just that all of a sudden you have 20% more savings because Medicare spends 2 to 3% of its money on administrative costs, and health insurance spends 17%, or I should say 20%. And then you would also see the savings in terms of providing medical care because doctors are not going to have to play, how do I learn the vagaries of the 14 different insurance companies that I deal with because of my patients? This is just a great argument for single payer healthcare.
Yep.
When you start to see what a little bit of government intervention can do in terms of cost savings.
And that's without raising taxes to, help supplement some of these programs as well.
Yeah, I mean, we're going to have to pay for it, but it's either you either pay $2 for it in the private sector, or you pay $1 for it in the public.
Yeah,
that's basically what it is. I mean, the numbers may be slightly different in that respect, but that's the dynamic.